Alright, so next we want to look at results. Results are exactly how they sound. With results, you are looking at who is in the study, how do the groups compare, you look at all the raw data and the graphs, the text or tables that are available, you're looking at points of estimates and standard deviations and confidence intervals. What does that all mean? Okay, well, let's start with who is in the study. Who is in the study is an example of descriptive statistics. Generally, this is where you will see inclusion and exclusion play a role. The very first part of a results section will generally tell you who was in the study, and examples of these descriptive statistics include means, medians, and standard deviations. How do the groups compare is an example of comparative or inferential statistics. Okay, you're looking at both groups, you're comparing them, and you're measuring the difference, like how much of a difference the therapy or intervention that's being looked at makes a difference or makes. Um, Results, please note results can be very hard to find sometimes. You would think they are more organized, but you really have to search for them and you need to read the results very carefully to make sure you understand what's going on. Um, Points of estimates is essentially relative risk. What is the relative risk? And then for statistical significance, you look at the standard deviations and confidence intervals, and essentially you are looking for a measurement of error. And for confidence intervals specifically, you are looking at error of range of the point of estimates. Okay, you want to be able to understand the graphs and you want to be able to know the difference between what is a good graph and what is a bad graph. There are some very confusing ones out there, and there could be a lot going on in the graph. Um, but that will come with time, so just know. So now we're going to look at how you actually appraise an article. We've talked about what it is and we've pretty much gone through it, but let's just kind of look at it. So how do you appraise an article? Most of it, don't freak out, is but it is common sense. You're really just taking what you're reading and making a decision on if you think it's valid. Would you use this? Could you apply this information? That's really what you're doing. It's not as scary as it sounds. You do not have to be a statistical expert to do this, okay? And there are checklists that will help you focus on the important aspects of the article so you know what you're looking for. There are all different kind of checklists depending on the type of study that you are looking at. And all of this information will help you to decide if research is valid and relevant. When you're, again, some of this is repeat information, but I want to make sure you get it. When you're praising an article, you're looking at the methods and results. Are they valid? Is the research question focused and original? Was the method appropriate? How was it conducted? As for results, how was the data collected and analyzed? Are they significant? And will this essentially help with your patients? Now, I added these few slides to kind of give you an idea of what you're looking for when you're appraising the different type of studies. So when you're appraising RCTs or randomized control trials, you're looking at recruitment and sample size. Um, how are they recruited and how large is the sample size that's being studied? What is the randomization methods and what are the controls? Are there any confounding factors? Is anyone blinded? Is it a single blinded study or a double blinded study? What are the follow-ups or the number of lost to follow-ups? And what is the intent to treat analysis? And are there any is there any adjusting for multiple analysis? I mean, look at many analysis. Um, Intent to treat, there are different variations of an intent to treat, but essentially it is how it sounds. A patient that may have been intended to treat. So an example, Within a stroke population, there's a study that a patient fits perfectly so far going through the main inclusion-exclusion criteria. You talk to the patient wants to do it, they sign the consent form, they're randomized. You continue and you go get a CT scan and you look at the angiogram and you go, wow, they no longer fit the inclusion criteria because there may be an aspect of the angiogram that you read that now excludes them. Okay? You wouldn't have known that until you've done the CT, but as a part of your protocol and process, well, they had to sign the consent form in order to do the CT. So therefore, this patient would be an intent to treat because you really did intend to treat them. You randomized them, they signed the consent form, they were ready to go. But looking at further inclusion exclusion, they no longer met the criteria. So you would follow this patient to for a certain amount of days or duration, whatever the protocol may say, still looking at them as if you were looking at all the patients that have been randomized into the trial, but they will be statistically looked at a little different when the trial is conclusions and results are put together at the end. When you're appraising cohort or case control studies, you're looking at recruitment. Is there any selection bias? Okay. Um, Remember, those are observational studies. So you're also going to look at exposure, measurement, recall, or classification bias, confounding factors and adjustment, time frames, and plausibility. A little quick tip that I like to remind people that, as a non-statistician, you tend to look for three numbers in the methods, and that is the size of the sample, the duration of follow-ups, and completeness of follow-up. Now you're going to look at everything, but these are three things that I generally like to make sure that I have stand out at me. You're going to look at sample size calculation. Now, this is where your stats come in, okay? This is based on primary outcome measure and depends on these various factors that are included, which include significance level, power, variability of the measure, level of significant difference. And you will look at both the statistical difference and the clinical. And remember, they are not the same. So you will look at both. So let's kind of go over what we're looking at. Let's say we're going through a research article and we're trying to piece together what is it that we're reading. Well, first and foremost, you're going to read the abstract. Are there any issues discussed there? What are the main findings of the research? Do you want to know more about the reading after? Do you want to know more after reading the abstract? And does it address a related question? And are there any reasons to doubt the findings without reading the whole article? Okay. So let's say you read the abstract and you go, yeah, I think this look like it could be a great article for what I'm trying to find. So you read the intro and the discussion. So now you're looking at, does it apply to what you are looking at? Is it worth to continue reading? You want to compare the abstract to the discussion because the discussion section is a little more detailed and precise than your abstract, okay? And it will explain limitations of research and possible implications which are generally not mentioned in the abstract. Then you're going to look at the methodology section, okay? Methodology section. This will give you a step-by-step description of exactly how the study was carried out. Where was the study done? From whom the study was collected? The data was collected. Is it a primary, secondary data? And how was the data collected? Results, again, exactly how they sound. Which statistical analyses were used? How precise are the results? And how are the results represented? Then you want to read the conclusion. What did you gather from the conclusion? After having read all of this, how is it tied together and what is it saying? Okay, so when you're looking at an article, you're looking at how good is the data? Does the study adequately control for differences between the groups being compared? Are the statistical methods appropriate? Is the sample large enough to produce significant results? How good are the measures? Do the measures accurately reflect what the researcher was trying to measure? Again, validity, internally and externally. How clear and appropriate are these measures? Are they too broad? Are they too narrow? Are they actual measures or are they proxy measures? And are their measures well established in either prior research or through pilot testing by the researcher? Or are they an ad hoc? Are the results relevant? Again, essentially you want to know, can you apply these? So you'll look at, can I apply these results to my own practice? Is my local setting significantly different? Are these findings applicable to my patients, and are they specific or detailed enough to be applied? Were all outcomes considered? You're also going to look at estimates of effect. This is the observed relationship between an intervention and an outcome. And you express results in terms of likely harms or benefits. So when you're looking at randomized controlled trials, it will tell you what are the harms and what are the benefits, because essentially within the trial you want to know, do the benefits outweigh the risk? Okay. You're also going to look at relative and absolute measures, which are like odd ratios, absolute and relative risk, benefits, mean difference, number needed to treat. Confidence intervals. Oh, those lovely stats just keeps following us everywhere we go. So within research or within an article, you may be looking at the confidence intervals, and you're looking at the ranges. And is the range of the values within which the quote unquote true value in the population is found. Okay, so let's talk a little bit about confidence intervals. So confidence intervals are used to describe the amount of uncertainty, associated with a sample estimate of a population parameter. Okay, so let's just say you have a 90% confidence interval that states that the population mean is greater than 100 and less than 200. Well, how would you represent this statement? Some people may think that there's a 90% chance that the population mean falls between 100 and 200, but this is incorrect, okay? Like any population parameter, the population mean is a consistent, not a random variable. It doesn't change. The probability that a constant falls within a given range is generally or always between 0 and 1. So the confidence interval describes the uncertainty associated with a sampling method. Hopefully that makes sense. If not, we can do a deeper look into stats later. So you will be looking at confidence intervals. So this is just a quick look at graphs. Now this is a exercise-based rehabilitation for coronary heart disease study, and it's comparing exercise versus usual care, and the outcome is total cardiac deaths. So in this case, we want less to be good. We want the number of cardiac deaths to be low. Okay, so this is just an example. This is an example where more is good. So this is a group behavior therapy program for smoking cessation, and these are groups that this is a group format program. This is looking at group format behavioral programs for smoking cessation versus other formats. And the outcome is smoking cessation. Well, we want the number of individuals using smoking cessation to be a success. So the more, in this case, is good.